Today, I wanted to talk about Medicaid advocacy that actually works at the state level. When physical therapists think about Medicaid, the conversation usually starts and ends with reimbursement. We talk about low payment rates. We talk about administrative burden. We talk about how difficult it is to participate in the program. Those are all important issues, but here's the problem. Too many PTs stop there. Complaining about Medicaid doesn't change Medicaid. The good news is that unlike Medicare, where changes often require federal legislation or national rulemaking, Medicaid is largely a state program. That means state policymakers, Medicaid agencies, and Medicaid managed care organizations have tremendous authority to improve payment and reduce unnecessary administrative burden. The question isn't whether change is possible. The question is whether we're advocating effectively. Every state makes its own decisions about Medicaid. States determine the fee schedules. They decide whether to increase payment. They negotiate contracts with Medicaid managed care organizations. They establish utilization management requirements. They determine documentation standards. And they decide how physical therapy fits into broader healthcare initiatives like value-based care. In other words, many of the frustrating private practice experiences every day are not federal problems. They're state policy decisions. And state policy decisions can be changed. Actually, a lot easier often than federal policy decisions. We've seen states improve payment rates. We've seen states modernize prior authorization requirements. We've seen states adopt policies that improve access to physical therapy. Those changes didn't happen by accident. They happened because physical therapists showed up with a plan and advocated. Let's start with what doesn't work. Walking into a legislative office and saying Medicaid doesn't pay enough. Everyone already knows that. Saying physical therapists deserve more. That's not a persuasive argument. Or telling policymakers that your clinic is struggling financially. While that may be true, policymakers have dozens of competing priorities. Advocacy becomes effective when you shift the conversation away from your business and toward your patients and your state's healthcare system. Successful Medicaid advocacy usually has four characteristics. First, it starts with data. How many Medicaid patients cannot find a physical therapist? How long are they waiting? How many clinics have stopped accepting Medicaid? What happens when patients don't receive therapy? Those are questions policymakers care about. If you can demonstrate that inadequate payment reduces provider participation, delays care, and ultimately increases healthcare spending, you've changed the conversation for them. Second, it's important to make a specific request. Don't simply ask for better reimbursement. Ask for Medicaid payment to be benchmarked against Medicare. Ask for annual payment updates. Ask for prior authorization reforms. Ask for adoption of clinical practice guidelines when determining medical necessity. Specific requests lead to specific policy changes. Third, build coalitions. One clinic has a story. A state chapter has hundreds of practices. Partner with physicians, occupational therapists, speech-language pathologists, hospitals, patient advocacy organizations, and employers whenever your interests align. Broad coalitions demonstrate that these aren't provider problems, they're healthcare system problems. And finally, it's so incredibly important to stay engaged. Advocacy isn't one meeting each year, it's building relationships over time. Meeting with Medicaid officials before problems become crises. Following up after legislation passes. Providing data when it's requested. Helping regulators understand how policy decisions affect patient care. The most successful advocates become trusted resources, not just occasional visitors. Here's the opportunity. Every state is trying to improve healthcare quality, increase access, and control costs, even though federal dollars are shrinking. Physical therapy helps accomplish all three of those aims. As a result, our job is to make sure decision makers understand that investing in physical therapy isn't simply about spending more money. It's making smarter healthcare investments. When Medicaid patients receive timely physical therapy, they often avoid more expensive imaging, injection, surgery, opioid use, emergency department visits, and hospitalizations, as you well know. That's a message policymakers understand. The next time you think about Medicaid advocacy, don't ask, why won't they fix this? Ask instead, what evidence can we bring? Who should we bring it to? And what specific change are we asking them to make? Because the states making the greatest progress aren't necessarily the ones with the biggest budgets. They're the ones where physical therapists consistently show up, speak with one voice, and advocate with purpose. Thanks for watching this. If you'd like to learn more about state payment advocacy resources and successful strategies from around the country, visit Spark and connect with your APTA chapter. Together, we can build a stronger payment environment for physical therapy and better access for the patients all physical therapists serve. Thanks for watching.